Just getting.
Good morning, everyone. Thank you for joining us and happy Friday. You have tuned into the Real-Time Solutions webinar series brought to you by the Apple Valley, Burnsville, Hastings, Lakeville, and River Heights Chamber of Commerce. Some housekeeping items for this morning. All participants are muted, so please use the Q&A feature to ask questions, and we will get to as many as we can following the presentation. This webinar will be recorded and made available on Chamber Partner websites. The goal of these webinars is to address business concerns and questions as we continue to socially distance ourselves during COVID-19 pandemic. However, considering the ever-changing business practices, the partners will continue to explore ways to use technology in our Chamber's future programming. My name is Christy Bars, and I am president of the Hastings Area Chamber of Commerce and Tourism Bureau. We are here today to hear from Helen Strike, president of Allina Health's Regina Hospital and River Falls Hospital. Helen has graciously offered to take time out of her demanding schedule to provide us with a state of healthcare from a local perspective. Thanks for joining us, Helen, and I will turn it over to you.
Good morning, Christy. Good morning, everyone, and thanks for joining us this morning. Wow, these are certainly unprecedented times, and I'm grateful that we're all trying to seek as much information as we can. I want to start by saying that this is COVID-19 from the Allina Health perspective, and here in Hastings, we're the main provider of healthcare and to our community. And I know for sure that all of you are seeking and seeing providers from all of the different systems in Minnesota. And I want to say thank you to any of you who would be on the phone from those systems for all the incredible work that you're doing to ensure the safety of our patients and our employees. This has been extraordinary, and I think for all of us, we would say none of us, unless you have lived through World War I or II, or perhaps served in some of the great other wars, that it is a time that which we have never seen anything like this. And I'll just start off with some stats we got from Minnesota yesterday, just to give you a little perspective. Then I'll talk about what's all the fuss about? Why are we worried about COVID when perhaps we're not worried about other things? And then what about Allina Health, and what are we doing? And what have we learned, and what have we done? I think one of the most extraordinary things about people and about groups around the world is that when there is a issue and when there is a worldwide pandemic, we have proven that we will innovate in ways faster than we've ever thought before, optimize things we've got in place and develop new ones. And it's truly the testament to human nature, human innovation and productivity. So as of yesterday, Minnesota had 5,136 positive cases of coronavirus, or SARS-CoV-2, or COVID-19, as we call it here. We have in those, and this is an important stat for you, 2,172 of those folks who had COVID no longer are requiring isolation. And that's important to think of all those people who are well now. We've had 343 deaths as of yesterday, and I remember the day of the first death back in early March and thinking, I wonder when we're going to start to see numbers in the hundreds. And here we are on May 1st with 343 deaths. In Minnesota yesterday, we had 365 patients hospitalized in our systems with COVID-19. And 130 of those are in our ICUs. The thing to remember most is the curve is very flat in Minnesota. I think we're proudly seeing all of the stats we see, whether we see them on Facebook or on New York Times or the news or the Johns Hopkins work that they've been doing, showing Minnesota's curve is actually flatter than California, which is an incredible thing that California has been able to do as well. My daughter lives in San Francisco, and she is on her 9th week of stay at home. So they have been at this a long time too. So what's all the fuss about? Why is this different than seasonal flu? So we look at things around this virus, such as the RO number, or how many people will be affected by the average individual with the disease. So this is about contact. So for every person who's infected with the flu, we can generally affect 1.3 people from that contact. For COVID-19, it's ranging anywhere from 2 to 2.5 now with all of our social distancing. If we allow, there's a patient 30 in South Korea who exposed over 1,000 individuals with her virus when she was just beginning to have symptoms, and she was doing her normal daily thing of lunching and going out and going to church and to raffles and all sorts of things. So that was definitely more than 1 to 2.5. The other thing about incubation time with COVID-19 is it's anywhere from 1 to 14 days, in more of a similar way than maybe some of the diseases we know about from the that are around, like Ebola, where it's 1 to 21 days for incubation. For the flu, it's 1 to 4 days. So when you've been at a party and somebody comes down with the flu, if you're out of danger in 5 days, you're pretty well clear from catching flu from that situation. But with COVID, it's sneaky, and it can hang around and wait 14 days while you are actually positive with the disease before you show symptoms. This one is a big one, hospitalization rate. About 2% of cases of the flu require hospitalization, and we're pretty clear now that between 19 and 20% of patients with COVID will require hospitalization, which has led us to hurry up and get additional capacity for ICU and med-surg all across the state. Case fatality rate, we don't know much about COVID right now, but it's sitting with a 1% to a 3.4% mortality rate, which is far higher than the flu. So this is what all the fuss is about. This is a novel virus. It's a part of a family that is fairly old when we think of SARS back in 2003 and MERS and the Middle Eastern respiratory syndrome. Similar type of virus. They are all SARS-CoV viruses, but this one is behaving a little bit differently for sure. Between SARS and MERS, we never saw a worldwide pandemic. So how do we know what to plan for? We see all these models that we see all over the place, and they're all useful, but many of them are wrong, and that's okay. But when you plan, you want to plan for worst case, not for best case or average case. While we hope our experience in Minnesota follows an optimistic model, we're not using a single model for preparation and risk because there's a high risk of being underprepared. So we use at Allina, we have some very talented people, just like M Health does, just like Health Partners does, and of course the Mayo. We are using sources from all of these models. The IHME model is the one that Washington uses that was developed by the Gates Foundation. All of these models come into play for our model for Allina. And we are able to use our own drivers for some of our own rates of hospitalization, our own rates of ICU, and our own rates of mortality. And so this allows us to be able to have a good idea. Flattening the curve, absolutely we're flattening the curve. We are staying well under, as you can see, with only 365 patients hospitalized in the entire state. That is less than a quarter of the beds that we would be having filled in any normal day when we had normal census points. Across Minnesota, our hospitals are anywhere between 75 and 85% full on a normal non-COVID experience day. So here's our predictive models, and this is why it's important for us when we think about returning to work and going what is the governor doing and why aren't we seeing this? Here's our predictive rates, and I'm sure they're similar to others, and they change weekly for us. Dr. Strauss and his team update these every week for us on Friday, so these are hot off the press this morning. That there weren't any big significant changes from last week, except for our ICU capacity will be reached June 24th. And here at Allina, we have almost 300 beds of ICU capacity now. A few weeks ago, we had 166 beds. So we've been working hard to increase across our sites the number of ICU beds and capacity. We also will see the peak of the ICU on August 5th. Doesn't that sound like a crazy amount of time away, you guys? And it is. And so we are starting to think about work in pre-surge and post-surge because we can't manage, just like many of you, we can't manage to keep everything closed and have patients not be able to seek care until June 24th, or all the way 14 weeks through the late September, which is the duration we're predicting for capacity. Our med-surg capacity is 8 weeks. That's been a change. It has been changed to go down to 4 weeks now. And of course, patients come through the ED, they go to the ICU, and in general, then they go to med-surg after. So there's a little bit of delay in that capacity based on the ICU length of stay. And then total ED visits are predicted to be around the same time as the ICU peak, which would of course make sense, that you have to generally come through the ED to get into an ICU. So this is why the governor is saying, when he's talking about opening things up, that part of your plan will be that you have to be able to immediately shut down again. That if we do see a surge, if we do have to put another stay at home in order, if we do have to cancel all the elective surgeries again, he wants us all to be well aware of that and be able to do that in our plans as we're making plans to open up. So yesterday, the stay at home was extended until March 18th, and that makes sense so that we can continue to have the curve be as flat as possible. And we are giving us more time to prepare. So Allina's done a lot. We have, of course, like everyone, no visitors to our hospitals or long-term care facilities. This is devastating to families, as we hear every day when we have someone coming in and passing away from cancer, or we have someone coming in and passing away from COVID-19. No one is allowed a visitor. And so there's been some remarkable technologies developed, but it's a very sad situation here. Having a baby, as you can imagine, in a COVID situation where you're not allowed any more than one person to visit you the entire time that you're in the hospital is very difficult. Universal masking of employees and patients and visitors. I was showing Christy my mask earlier. All of us are in the healthcare systems are wearing masks when we are at work. Employees, we give masks to our patients. Our visitors get masks. And we know what happens when you don't, when Mike Pence comes to visit. And so it's important for masking for everyone as source control. We want you to keep your germs, and I'll keep my germs, and that's what our masks do for those cloth masks. Immediate change management techniques. Holy crow, I can't even tell you. I ran the system incident command for about 5 weeks for the initial part of our Allina response, and I've never seen anything like this. We would announce a change at 8 o'clock in the morning so people had time to implement it, and there would be a federal government or a state government or even an Allina change that afternoon. It has been an extraordinary time of flexibility and requirements of patience from our teams. The changes of urgent to an emergency need to do surgeries and procedures. Of course, our surgery volume is down 91% from what it was the first 2 weeks of March. And this is devastating because hospitals are paid for procedures and sick people, and to have people not coming to the hospital with what they were coming to us before with because they're scared or frightened is, or because we tell you we can't, is devastating to all. Surge planning, we've increased our ICU beds 100%, our med-surg beds 50%. We've increased our ED spaces by 50%. We've cohorted and created COVID-specific units. We have TCUs that are part of our system that are now COVID-positive TCUs. And we also have healthcare at home, where we are keeping patients who are much sicker than they were before at home with ramped up, it's called home care max visits. Primary care and testing and tracking of healthcare workers is happening here too. And what are some of the innovations? Some of you may have experienced across the state virtual care first for primary care or specialty care appointments. We've gone from 100 virtual visits in January to over 8,000 yesterday. That is incredible to think that we are in a place where we can do something completely different than before. ED on my way on the website, allinahealth.org. You can tell the emergency room that you're coming ahead of time. Innovations in primary care and specialty care clinic setups here in Hastings. Our Hastings Frontage Road Clinic is now a non-respiratory clinic, so that anyone you will call first for an appointment. You're directed to a virtual visit. If you need to come into the hospital, into the clinic, and you have something other than respiratory symptoms, your diabetes or maybe your arthritis is kicking up, you'll be sent to our Hastings Frontage Road Clinic. If you do have respiratory symptoms or any of the screening that means you might have COVID symptoms, you come to our Nininger Specialty Clinic. And at that Nininger Clinic, we have curbside care and testing available as well. So that's our Hastings example of what we've done. And we know, and we're seeing examples of that on Care 11 and the Star Tribune all the time of what all the systems are doing to innovate care. Personal protective equipment is the #1 issue for our employees, and that reuse and reuse policies that are allowing us to safely protect our staff. It's not what we want to do. It's not what we wish we would doing. Everyone would love to have enough equipment for a new mask every patient or a new mask every shift. It is just not the case. And so we are grateful for the smart thinkers around the world and those industrial hygienists and epidemiologists and infectious disease practitioners and physicians who help us every day to keep our employees safe. The homemade cloth masks has been an extraordinary thing. We've had over 300,000 cloth masks donated to Allina Health and over 4,000 in Hastings. So it's just been incredible, and they come in every day. And of course, we're still taking donations of factory-made masks as well that people might have at home. I talked about Home Care Max coming, and we also are working in virtual teams with ED, MedSurg, and ICU that allows technology to be used to speak with a patient so that until we have an idea of what the patient has, to reduce that personal protective equipment and make sure that we are using the equipment based on the patient's history when they first come into our emergency room. So all of those things are things that some of them weren't here before. Many of them weren't here before. And for the stuff we had before, like virtual care or ED on my way, it has provided an extraordinary opportunity for us to care for you safely. Recovery plans are beginning to come into play. We know a little bit about Badger Bounce Back and some of the things that Governor Evers is doing in Wisconsin. For Minnesota, there's talk now about safely returning to work. For us at Allina Health, we're beginning to expand the amount of surgeries that we are doing pre-surge so that we're able to have some patients be cared for so that we are not delaying care any longer. This, as I said, has been devastating. And we all need your help actually to get people to come back to get care to their clinics and to their hospitals, because it is we know that there are patients out there who need care but are afraid to. So the message is from all of us in Minnesota that we can safely care for you. We have plans in place. We have the ability to separate patients in our clinics and in our hospitals. And we want you to know that when you need care, you need to get it and not delay that any farther, or else we'll be in a bigger social and public health problem coming in the end of the year if we don't. So Christy, that's all I have today, and I would love to answer any questions that anybody has, and thank you for the opportunity to share about Allina Health.
Thank you so much, Helen, for being on today. That was an excellent overview, and I know how busy you are, and I guess I would speak for everyone when I say thank you to you and everyone on the front line for everything that you're doing and your ability to adapt and innovate so quickly. I know you're changing system-wide procedures sometimes 2-3 times a day, and can't imagine what that's like. So I really appreciate you taking the time to give us this important overview, especially with the announcement that came yesterday. So we do have a couple questions here. First is just a shout out from, I believe, your peer, Brian Knapp, over at
Yay.
He says, nice job, Helen. Thank you for leading and sharing, Brian.
Thank you.
And then another question that we have here, does the hospital system feel Minnesota is ready to reopen?
I think we feel that we are ready to reopen slowly. I think that this idea of flattening the curve to maintain hospital capacity is absolutely still important to us. And the ability for us to close down again is a really important one if we do see a surge. Nobody wants a New York City. Nobody wants what happened in the first few days of a New Orleans surge. So I think the caution that we're taking is important, but we do need to get open in some ways, especially if this surge is not looking like it will start in earnest until June. And so I do really believe that we all need to be able to get back a little bit and be able to test the systems and see what we've been able to accomplish, and then what we still need to do.
Perfect, thank you. We have another question. Thank you, Helen. How are you working with marketing teams to get the message out to people to come back? Setting the tone via press release, email marketing, new information material, etc.
Thank you. I think we were waiting to hear what Governor Walz did yesterday in terms of the stay-at-home, but we have social media campaigns about to start. I know I've seen on mHealth commercials on TV to start telling people to come back to get care. We are all trying to spread the word in every way. We talk a lot about 7 ways, 7 times for communication. I think it's 15 ways and 15 times now that we try to think about.
Thank you. Another question, it looks like a local question. Does Hastings and the surrounding area have enough testing for the community to monitor spread as it is occurring?
Well, we've opened up our curbside testing that is for anyone who's symptomatic. It's by appointment first, so you come into our allinahealth.org website and you'll be directed to virtual care, who will then help you to, if you have symptoms that match, help you to get an appointment for curbside testing. We did 40 tests in the rainy day on Wednesday, and we did 80 tests yesterday. So we are testing at Hastings as much as we possibly can. We are being asked in Minnesota to test up to 5,000 patients a day. Allina Health has the capacity to test over 1,200 of that 5,000. So we have capacity left that we're not using right now at Allina. And I almost said Ministry of Health. I'm Canadian, sorry about that. The Department of Health is said yesterday that they have capacity to do more testing. So that's good news. We need to make sure that we are pointing people to testing when we need them. You still need to be symptomatic. No, we're not doing asymptomatic testing, and we're not doing any of the antibody testing yet.
That is good news. I will leave it up for just a minute. If anyone else has any other questions for Helen, please type it in the Q&A at the bottom of your screen. Okay, well, I think that wraps up today's webinar. Oh, wait, I apologize. We have, looks like, one more. If you think you've had COVID-19, would giving blood or plasma help others?
I think that's a great question, because we're hearing about that. And didn't Tom Hanks just tell us all that he and his wife Rita are giving their plasma? I think it's worth talking to your provider for sure right now. There are lots of things they're doing with COVID survivors, and and there's many of us out there because many of us may have had what we thought was the flu, and we don't know. So right now, the first place to start is with your primary care provider and talk to them about that. Talk to them about any trials that the system may be involved in with the university or Mayo in terms of antibody testing, and be able to point you in the right direction of where to start down that road.
Thank you. And it looks like we do have another question. As many of us are planning our summer out, in your opinion, do you feel that large gatherings should be canceled through the summer?
Oh, yeah, I was doing this, don't have it. Yes, my nephew and his fiance have canceled their wedding and taken it out a year. I think that large groups we have to be extremely cautious about, even in countries where there is opening up happening. They're talking about no more than 10 to 20 in a group. I think this social distancing thing has been the ticket, everyone. I think that 6 feet apart is important. And when you're in a situation like what we always used to love to go to, festivals and fairs and sporting events and other things, weddings, I think if you just point back to if you ever were at a place where norovirus went through a wedding or a cruise ship or anything like that, we know how fast things can get out of hand, and this is not a time for us to play with the risk. I really do believe that. I think for the whole year we'll be seeing and maybe until there's a vaccine, seeing a reduction of large groups.
I appreciate your honest feedback. I think many of us are kind of looking for that type of honesty as we plan ahead. So I appreciate that feedback. And we'll take one more question here before we wrap up. This one is, are there any special plans being discussed with local government to monitor and test first responders?
The governor and Department of Health opened up testing to first responders a couple of weeks ago. And so symptomatic first responders are eligible now. Remember, that wasn't the case when we were very short on tests. Just overall blanket testing of healthcare workers and first responders is not on the board right now. It's not in most states. We are not in a place in the United States where we can blanket test the population. And if we could, we would start with our healthcare workers and first responders for sure.
Perfect. Well, with that, I just want to thank you again, Helen, for joining us today. This update on the state of healthcare is a timely reminder our sacrifices are making a difference. And I want to again thank our frontline workers in the healthcare industry for their tireless work to save lives during this time. The Real-Time Solution webinar the next Real-Time Solution webinar, will be held on Wednesday, May 6th. The topic is Back to Business, Ready Your Retail Operations, with special guest Bruce Nusted, President of the Minnesota Retailers Association. Today's webinar was provided in partnership with the Apple Valley, Burnsville, Hastings, Lakeville, and River Heights Chamber of Commerce. The recording will be made available on partner websites. Thank you again and have a great weekend, everyone.
Thank you.